Dear students, we are in the second part of FNMS. So NMES is dependent upon an intact alpha element. Already we understood that, but that is in the lower motor neuron denervation where the regeneration has to happen. So that happens mostly in neuropraxia and uh, mainly in neuropraxia, or if it is in axonotomesis or neurotomesis, then it is after the surgical suturing of the nerve. However, clinical applications of NMEs is presently limited to neurological injuries involving the upper motor neuron, such as the common severe injuries such as spinal cord injury, stroke, CVA, brain injuries, any road traffic accidents, RTS leading to brain injuries, multiple sclerosis, cerebral palsies. So these are the common conditions in which the in functional neuromuscular stimulation or NMES or FES is indicated, which are upper motor neuron, spinal cord injury, stroke, CVA, all kinds of stroke, brain injuries. Basically, we are talking about traumatic brain injury or any RTFs leading to traumatic brain injuries, and multiple sclerosis is a one of the degenerative conditions where muscle weakness is happening. So we uh, apply stimulation, electrical stimulation to maintain the muscle strength. And also mainly in the cerebral palsy, where the muscle weakness is predominant. So to prevent any kind of atrophy and also the uh, prevention of deformities. So NMES is delivered as a waveform of electrical current characterized by stimulus frequency, amplitude and pulse width. So mainly it is given in a waveform. So two types of waveform are given. One is biphasic and uniphasic. In this biphasic, we are giving biphasic in NMES. In the biphasic, we have symmetric as well as asymmetric waveforms. So the stimulus frequency, stimulus amplitude, and pulse width is very very important. So mainly the frequency of the wave and the pulse duration, and then the amplitude is the intensity. So three characteristics are which of the waveformed electrical current is important. So when you change the frequency, when you change the intensity, when you change the pulse duration, the type of stimulation produced by the electrical current changes. So that means that dosage is based on these three characteristics. The amplitude and pulse width determine the number of muscle fibers that are activated. So that means pulse width and intensity. Amplitude means it can either be voltage or it can be ampere. So both voltage or ampere is the amplitude. Pulse width is a pulse duration. So according to the width of the pulse, how long does the electric pulse exist during a particular stimulation. So that also will determine how many number of muscle fibers will be activated. Temporal summation is determined by the rate at which stimulus pulses are applied to muscle. So the time temporal means the time summation, time related summation of the particular stimulating wave is determined by the how many number of stimulus or pulses are applied to the muscle. So number of stimulus, that is what we call as uh, hertz, that is a frequency, how many pulses in a particular time, that is called as frequency. So here three characteristics I have told you of a electrical current which is going to stimulate a particular neuromuscular junction or a nerve, peripheral nerve. So here basically the two things, which is the amplitude, it can be either ampere or voltage, that, and along with that the pulse duration will determine how many number of muscle fibers will be stimulated. Second thing is the frequency is how many pulses per seconds. So how many pulses per second will, that is what we call as temporal summation. So that will be the timing of the stimulus and the type of timing, such as tetanic contraction, whether it will be tetanic contraction or a worm like contraction, which we already know in the galvanic and the Faradic current type of contraction. So that will be defined by the frequency. The strength of the resultant muscle contraction is modulated by the adjustment of stimulus parameters. So all this will be muscle contraction modulation is mainly by stimulus parameters, which we already discussed. The minimum stimulus frequency that generates a fused muscle response is 12.5 hertz. So minimum the frequency should be 12.5 hertz to produce a fused muscle response. So what is a device use? Most clinically available FNEMS system fall into two broad-based categories. One is transcutaneous, that is which is kept outside the skin, transcutaneous, which is normally used. We normally use the transcutaneous, especially in India. We commonly use only transcutaneous. The other one is implanted. We can implant the electrode. Students, I am not going to talk much about the electrodes and all, because we have already studied this in the second year in the electrotherapy. So you have to, all know that there is going to be an active and inactive electrode. So according to the motor point stimulation and nerve superficial area of the nerve where we are going to keep, whether in the cervical region for the upper limb or in the sacral region for the lower limb, or wherever it is the nerve becomes subcutaneous, we keep the inactive and active in the motor point. And here we are talking about the neuromuscular stimulation. So both the nerve and the motor point will be stimulated. So here we have two types of a broad category when we are talking about the device, which is one is transcutaneous, which is externally over the skin we place it, and the other one is implant. In the implanted, we can put it either percutaneous, just below the skin, epimysial, just outside the epimysium, perimysium, just below the perimysium, the epimysium is there. So you'll be putting there, or epineural, that is more related to nerve, the outer layer of the nerve, and the intraneural, that is very very what you call as very small nano chips which you are going to, not chips, nano electrodes which you are going to put, or the cuff systems. So percutaneous, epimysial, epineural, intraneural and cuff systems, which are all part of the implanted electrodes. The mainly commonly used is a transcutaneous in India especially. NMES systems are either voltage or current regulated. Despite the variable motor response, voltage regulated stimulation is most common with transcutaneous FNMES system, as impedance resistance increases due to electrode skin interface changes, current is decreased. So here, because in India we don't get mostly the external device is mostly used by voltage system. So voltage system more, because the current system, the current power of the current may change, and sometimes this will be corrected using a stabilizer. So the voltage fluctuation or the power fluctuation can be maintained using a stabilizer, and then connecting the electricity connection through the stabilizer to the device. Current density as opposed to the absolute voltage determines the potential for tissue injury. So current density is very important. We should have a good knowledge about that, otherwise potential of tissue injuries can happen. So all the contraindications has to be taken into consideration. Due to less variability in resistance and the need for muscle contraction, consistency and repeatability, constant current application are more common in implanted FNME system. So in the case of voltage based system device, it is mostly used for transcutaneous. So most of the equipments we are using are based on voltage based current system. But for implanting implants and all, no, the where the implants are the electrodes are an implant, then it is better to use a constant current application. Electrode type impacts on potential for tissue injury and efficacy for intervention. So choosing the electrodes are very much related to which area you're going to treat. The simplest electrode is the transcutaneous electrode, that is applied to the skin and stimulates directly over the peripheral nerve or motor point, which is common. All transcutaneous electrodes use external leads to connect to a stimulator. The two electrodes placed in either monopolar or bipolar configuration are required to produce an electrical current flow. the active electrode is placed directly over the peripheral nerve or motor point. The indifferent electrode is placed either on fascia or a tendinous insertion, that is monopolar. So tendinous insertion or fascia, that is mainly by monopolar, and near the active electrode, that is bipolar. Bipolar stimulation creates a more localized electrical field which may result in greater selectivity of muscles. So FNMS, now we are coming to the therapeutic part. FNMS for motor relearning program. So mainly the what we are getting achieving is a relearning of motor activity, either in the case of peripheral nerve injury or in the case of upper motor neuron lesion. Muscle atrophy. For muscle atrophy, neuromuscular stimulation treatment is covered when one of the criteria below is met. So what are the criteria? Treatment of diffuse atrophy, mainly treatment for diffuse atrophy where nerve supply to the muscle is intact, include. So that means there is no peripheral nerve injury, but there is atrophy due to problems such as including pathology of brain, spinal cord, and some cases peripheral nerves, and other non-neurological reasons for diffuse atrophy. Some examples would be casting or splinting of a limb, contracture due to scarring of the soft tissues as in burn lesions, and hip replacement surgery until orthotic training begins. Functional electrical stimulation device consists of an orthotic and a microprocessor based electronic stimulator. See, where here when you come to the FES, functional electrical stimulator, it is a more computer based system. So microprocessor is there. So all those commands and everything is controlled through a very smart computer, and orthotics also is given so that the electrodes are not moving. So orthotics are given, which we have told I have showed you in the earlier picture. In the first slide, you have seen that when you are putting it in on a particular area like a knee or a back muscle, you are also wearing an orthotic device so that the stimulating electrode does not splay or move away. So microchip processor and orthotics are common along with very very good sophisticated FES device. So one or more channels for delivery of the individual pulses. So it is not necessary you can only use one channel. You can use many channels. So multiple stimulation of particular motor point areas can be done, and surface or implanted electrodes connected to the neuromuscular system, either through the surface electrode, that is the transcutaneous electrode, or through the implanted electrodes. Microprocessor programs activate the channels sequentially or in unison to stimulate peripheral nerves and trigger muscle contraction to produce functionally useful movements that are. So here, when you are using these programs, because functional activity has to happen. So what are the functional activity which the patient may do? In sitting, the patient may be allowed to sit and then do some activities of the hand, upper if it is for the upper limb, or if it is for the lower limb, sit and then do knee extension flexion exercises, or standing and then using upper limb, or standing and then using single limb stance, or those kind of activities, walking, cycling, or grasping. So all these kind of functional activities can be applied along with the FES function FNMS. The functional neuromuscular stimulators are closed loop system. The system is a closed loop. We don't believe the. So here the whole, if you draw a diagram, the whole person and the equipment, the system will be totally forming a closed loop that provides feedback information on muscle force and joint positions, thus allowing constant modification of stimulation parameters which are required for complex activities such as walking. So because it is a closed loop, the stimulation is coming, artificial stimulation, the muscles are getting stimulated. At the same time, the information is of the contraction can also be taken as a feedback, and EMG feedback is also going. Also we can add other biofeedback alert systems and correcting systems which using sound and visual cueing for the patient. So this is a very good system with a closed loop system which is also giving a good feedback to the patient. These systems are contrasted with open loop systems which are use of simple tasks. If you are using a simple task, then use a open loop system. Healthy individual